What's up, Libby? Hey, folks, how we doing? What's going on? Hey, Dr. Ian here, Dr. Autoimmune. Hey, so it's Tuesday. We're back at it. So we're going to go through inflammation and basically root causes of inflammation. Again, if you guys don't know what inflammation is, well, there's 5 cardinal aspects of inflammation: rubor, dolor, calor, and tumor. And if you're a healthcare practitioner, you might be having a flashback right now because this is how it was described in basic lectures. But basically, we've got heat and redness, swelling, pain, but there's actually 5 aspects of inflammation, and that is loss of function, right? So when we're talking about inflammation, we've got heat, redness, swelling, pain, but that all leads to loss of function. So we're going to get into what are the mechanisms, what are the reasons that actually, again, causes inflammation, right? There it is, Robbins' textbook of pathology. Yeah, we use that. And it sucked. It was like this thick. It was disgusting. But anyways, that being said, right, we have a scenario that in this country, in Western medicine, we have the general philosophy. If there's inflammation, right, so we have heat, redness, swelling, or pain, we have loss of function, right? We go through the name it, right, and then blame it, right, and then we are going to tame it, right? So that's going to be things like non-steroidal anti-inflammatory drugs, okay? 30,000 people every year die of properly prescribed non-steroidal anti-inflammatory drugs, okay? True Marie, dermatographia, no, is not an actual autoimmune disorder. However, people with dermatographia do have elevated levels of IgE. And so what she's talking about, guys, dermatographia, if you can take a pen and you can write your name, right? And then it shows up as a red wheel and you can actually see that. That's called dermatographia. It's an elevation of your IgE. And your IgE, immunoglobulin E, is a protein. Your body makes antibodies from that protein itself, right? But what happens is because of environmental and internal issues, you start to produce too much IgE. So crazy high levels of IgE has been shown to be connected to parasitic infections, but very commonly when you get swung to one side of the immune system, because that is the same side as allergies, asthma, eczema. So when you're swung to one side of it, very commonly you could actually kind of write your name in your skin, and we call that dermatographia. So what can you do? Well, probably the first thing, again, symptomatically you can do is actually take quercetin for that. But remember, quercetin is also another approach to go after the symptoms, right? But you're not asking the question is, why is it there in the first place? Okay? So again, we can name it, blame it, and tame it with non-steroidal anti-inflammatory drugs. Again, like I just said, you guys may or may not be aware, the properly prescribed ibuprofen, Tylenol, aspirin, all of those, naproxen, Aleve, right? All of those medications cause upwards of 30,000 deaths every year, right? Celebrex, terrible. Okay, and then on top of that, yes, we're gonna have issues with kidney and liver, and it's gonna cause GI bleeds, and this is why people end up dying, is they have been taking 800 milligrams of ibuprofen for months, if not years, and no one told them that that's maybe a terrible idea and there's going to be secondary side effects. In fact, you guys may say, well, there's nothing wrong with my liver because my liver enzymes are normal. Well, it may take you upwards of a like 50 to 60% loss of liver function before you even see elevation of liver enzymes. So liver enzymes are not a good reflection of your liver function overall. It is something, obviously, if it's an emergency, yes, it's going to show up on labs, but it not really is a great place to look at just AST, ALT, and see where your liver's at. Okay? So, Becca, you're allergic to NSAIDs, right. So, but then on top of that, again, if you guys are, is anybody dealing with autoimmunity? If you guys are dealing with autoimmunity, just tell me what kind of autoimmune issue you guys are dealing with. It's lupus or Hashimoto's or rheumatoid arthritis. So I want to hear from you guys, what is it specifically that you guys have? That'll also help me figure out like what we're going to talk about. Ulcerative colitis, lupus, right? What else we got going on there? I know we got Hashimoto's. Yep, Jennifer, Hashimoto's, right? Rheumatoid arthritis, eosinophilic esophagitis, polymyalgia rheumatica, right? Psoriatic arthritis, lupus. For some reason, lupus is being, it's weird. TikTok is silencing my certain comments, and I'm not doing it myself. I'm not silencing any of these people, and I've actually looked and seen it. I can't change that, so I don't know what's going on. So if for some reason you guys are not seeing your comments, it's not me. I promise. I'm not trying to silence you guys, but for some reason TikTok is like not allowing certain things to be broadcasted. So again, the other mechanism, Monica, that's what I have, is celiac disease. So if you guys don't know, then that's my journey into the world of autoimmunity. In my grad school program, I got diagnosed with celiac disease, had a slew of neurologic symptoms, not a lot of gut symptoms. Neurologic symptoms is what I really had. Depression, anxiety, insomnia, fatigue, attention deficit issues. It all was snowballing. And yeah, I had some gut symptoms, but I didn't really think much of it. And because I had such dramatic and impactful neurologic symptoms. So Sjogren's, ulcerative colitis, yep, lots of that going on here. So again, we've got these cardinal signs of inflammation. It leads to loss of function. We can name it, blame it, and tame it with things like NSAIDs, right? So we got disease-modifying drugs, right? We've got prednisone. You guys all love that. Prednisone. Woo! Prednisone is like a miracle. And then you're like day 7 on it, or day 14 on it, or day 21 on it. You're like, I don't like prednisone anymore. There is very much a love-hate relationship with prednisone. And some people, it's right off the bat that they hate it. Some people go, oh my gosh, like I got some relief of my symptoms. I feel better. But then they start to go, oh, wait a second. This was not worth it. I really don't like that. So again, and of course, there's people who are on COX inhibitors, Celebrex, etc. And again, there's also Vioxx, which was very similar to Celebrex, which we would call prostaglandins, right? Inhibitors, but again, turns out that it was supposed to not cause GI bleeds, and that was not at all the case. So there was data omitted from the medical trials that they did. Turns out there was more side effects with Vioxx, and I believe that killed a couple 100,000 people. Couple 100,000 people died because of Vioxx when it came out. So yeah, so we left this weird gray zone, right, where we're going, okay, well maybe what we need is like, turmeric, right? Or we need vitamin C, or we need EPA, DHA. What's EPA, DHA, guys? Who knows what that is? Eicosapentaenoic acid, also known as, right? There you go, omegas. That's right, Spiral Shell, good job. So omega fatty acids, omega-3s, right? And there's borage seed oil, and there's, linolenic acid, like, again, they're all examples, and they all potentially have anti-inflammatory ability, right? You've got resveratrol, right? And you've got N-acetylcysteine, and we've got, what else? Selenium is anti-inflammatory, right? We've got, what else should we put on that list? EGCG, right? We've got alpha-lipoic acid, right? ALA, right? GLA, gamma-linolenic acid, alpha-lipoic acid. So, Libby, why is your anxiety a nightmare while on your period? So there's a very good reason for that. One, again, it may be actually your balance of essential fatty acids is off. 2, when you surge estrogen, those people that are already estrogen dominant, when you're surging estrogen, you're changing your neurotransmitter. And really, again, what happens is, so there's a ratio between estrogen and progesterone. Progesterone in general is actually what allows you to utilize GABA. That is the brake. Okay? So estrogen is going to be one of the accelerators, and progesterone is actually going to be a brake on neurotransmitter function and especially how you feel when it comes to things like anxiety. So the interesting thing is that if you start to lose that balance between progesterone and estrogen, that actually becomes an inflammation root cause. Because you have to realize that your hormones are really influencing the majority of your cells in your body. So hold that thought. We'll come back to that because we need to talk about estrogen and progesterone, because the other symptom actually of low progesterone as well would be insomnia. So poor levels of progesterone can cause insomnia, especially, again, estrogen dominant. So a lot of times women, as they go into the menstrual cycle and they're like not sleeping well, probably, again, you're estrogen dominant versus your progesterone. And again, there's always a reason why. What we don't want to do is take this, again, name it, blame it, and tame it, the pill for the ill, and assume that just because we have something like C-reactive protein that you need to take a drug to squash that. Because again, that's coming from inflammatory chemicals, interleukin-6, TNF-alpha, right? But it's actually toll-like receptors, which, guess what, are found on mucosal surfaces. And so all of a sudden, you can take a drug, right? You can take Humira, Enbrel, and Teracept to drop your inflammation, right? But then you've completely ignored why it's happening in the first place. So let's go through, right? And I'm not against any of these supplements, right? The problem is in lieu of finding the root cause of the inflammation, those don't do jack. I've tested thousands and thousands and thousands of patients, pre and post testing. I have the very best supplements that you can buy, right? And if you don't find the root cause of the reason why you have inflammation, which, guess what? That translates into brain fog, joint pain, fatigue, left long enough, your A1C will elevate. You will start to get insulin resistance. Left long enough, you are going to see stiffness in the morning. You're going to feel beat up in the morning when you wake up, right? So your quality of sleep, your quality of life, your mobility, your brain function, your endocrine system, i.e. fertility, it is... I love TikTok. Yes, my dear, I am married. But thank you for playing that game. So anyways, back on track. So TikTok, you crazy. So we have to focus on the inflammation and the reasons why we have inflammation, right? Shiny AA. Why does rheumatoid arthritis happen, right? We're very happy. We've been married for a little bit over a year. So very, very, very much in love with my wife. Love you, babe. Whether or not you're watching or not, I love you, babe. Okay? So what I want to do is help you understand, right? Why does a drug model fail, right? So again, let's see. Okay, so let's say we're taking Humira. Okay? And we're using that to try to block the C-reactive protein, right? It'll do that. And then what's going to happen is it is also going to blanket suppress the immune system. So what does your immune system do? How about it fights off infections? So what if one of your inflammation root cause is, we call it an occult infection. It's just a hidden infection. What if one of the main reasons is that you have an occult infection, and let's be more specific, in the gastrointestinal tract, and you decide to suppress your immune system? What did you just do? Woo! There it goes. Off to the races. It's the same thing for Cosentyx, Lori. Same thing for Otezla. makes it worse. So when they say to you guys, you're going to have this disease the rest of your life, they are guaranteeing it for you. Jennifer, we'll talk about the gut here a little bit, okay? Because we have to talk about the gut, because guess what? The gastrointestinal tract, the GIT, right? That's where we have 70% of our immune system. So look, I've seen people with dental issues. I had a woman, and she had fibromyalgia, and she also had Hashimoto's, and her mouth was such a mess. I said, I don't even want you to start care with me. You need to go get your mouth fixed up. Go spend, I was like, look, she was like, look, I can spend my money with you, or I can go to my dentist and fix my mouth. And I was like, go fix your mouth first. Because I felt inherently, right? I had a feeling, you guys, it's also called the Holy Spirit. But that feeling to me in that moment when I had a consult with her is I needed to send her to a dentist. So her mouth was a wreck. And that, guess what? She came back to me. She had lost 60 pounds. 60 pounds. She was like about 300. So she came back and she's about 240. Her inflammation markers were down. They weren't perfect, right? But her inflammation markers came down. And her energy was up. She was sleeping better. And she was ready to take on the dietary advice, the recommendations, all the rest of the work. And we did that with her. We just had to wait about, I think, 8 or 9 months until she came back in the office. So the point was, right, is that we need to understand where the inflammation is coming from. You can't ignore if you have periodontitis. You can't ignore if you've got chronic upper respiratory tract infections. You can't ignore if you've got gastrointestinal symptoms, but 40% of my clients do not have gut symptoms. They have normal bowel movements, they sink, they don't have a lot of smell to them, yet that is still one of the cruxes of the reasons why they're developing inflammation, right? So not only, right, can we see infectious issues, but also very commonly, right, is what's also really important is that again, there's a microbiome. And your microbiome is what, again, has in there, we call it your flora. So there's literally species in there that modulate your immune system if they're fed correctly. So no fast food. It ain't gonna work. If you're eating non-organic foods, and one of those happens to be wheat, one of the things they add into wheat is glyphosate. So if you are consuming, right, Roundup, one of the interactions that's gonna occur is you're going to target and you're going to destroy beneficial bacteria. So guys, there's the biggest reason why we encourage an organic-based diet, or at the very, very worst, okay? Think about Environmental Working Group. The Environmental Working Group posts a list of what we call Clean 15, Dirty Dozen, right? And so what that means is spiral shell. That's a really good question. I'm gonna get back to that in a second. What that means is that when you avoid foods that have pesticides, you're not trashing your microbiome. But again, keep in mind, your microbiome is in your mouth, it's in your respiratory tract, it's in your lungs, it's part of the placenta and fetus. There's a microbiome interaction going on there. There's a microbiome going on in your gut. Libby, you're not necessarily doing anything wrong, right? That you spent that much money. So that's why she's like, hey, I just spent $300. Like, what am I doing wrong? And I'm like, you're not. Dude, we're living in an economy of inflation, guys. Like, I'm sorry. Like, it sucks. Our government sucks. Our leaders suck. It sucks. It's just a lot of suck going on right now. And do not expect those levels to come down. So I shop at Costco. And again, I've got a big family. I have to prioritize what my expenses are and where I put that money, right? It is not a good thing for us to again, unfortunately, we just can't throw money around there. Okay? What I want you guys to understand is when you're shopping, right? Only go to the outsides of the stores. You don't need to go to the inside of a store. Stay to the outside, right? What's up, Ohio? So, and here's the thing. When I shop produce, a lot of produce that I see at Costco and Sam's and that stuff, it's not that great, okay? Sometimes it's decent because they just go through such a high volume of that. But I'm going to go to natural grocers. I'm also going to grow my own stuff. I also hunt my own meat. So, look, there's just different ways to do this, but knowing where your food comes from, knowing what you're putting in your body, removing crap is going to make a huge difference when it comes to your inflammation levels. Okay? So if you tested, so back up. Mom's Lambie, if you tested positive for HLA-B27, yes, we know, right, you're at an increased risk for seronegative arthritis conditions, psoriatic, not rheumatoid, but psoriatic, Reiter's, ankylosing spondylitis, etc., right? Pay attention because these inflammation root cause issues are what's driving that. Microbial issues are one of the most important things when it comes to rheumatologic conditions because your joint tissue is very similar to, again, Porphyromonas gingivalis. That's a bug in your mouth. Proteus mirabilis, that could be your urogenital tract or in your gastrointestinal tract, right? So there's specific organisms that cross-react to our tissue, and if you have genetic susceptibility, environmental factors, triggers, and guess what? Leaky gut. Now that's when you turn on autoimmunity. And now when you have inflammation, inflammation begets inflammation. The difference between me and a rheumatologist is I'm never going to recommend something like Humira, Enbrel, Interocept, Otezla, all these kind of, right, Cellcept, or prednisone, because again, you're squashing the immune system and you're potentially increasing the chance you're going to always have the autoimmune condition. I need to know if what we're doing root cause, if you're seeing resolution in not just your symptoms, but your objective labs. When you see your objective labs change, you go, wow, I changed my diet and I cleaned up my sleep and I'm taking some, accurate supplements to my specific issues. And look what happened. My brain fog started going away. My joint pain started going away. My fatigue levels came up. My C-reactive protein levels came down. And I didn't have to use a medication to do it. That's when you get that positive reinforcement, right? This is what life is all about. It's just like potty training. We're getting excited, right? Because the kid's learning how to poop in the toilet. Same thing for you guys. You need positive reinforcement. How are you going to get positive reinforcement from your body if you just freaking squash all that and match up to you? TASH, yes, frozen section fruits and veggies. At the very least, it's definitely better. If you're increasing your vegetable and your fruit content, fantastic. But fruit leathers and fruit juicing and vegetable juicing, carrots and beets, that is not healthy. Oh, I'm going to get me a shot of beet juice. Dude, what did you just do to your blood sugar? One of the most common causes of inflammation, right? It's your blood sugar. So again, spiking blood sugar, right, is going to make you surge insulin. And who gets autoimmune diseases more? Women or men? Yeah, please don't juice for iron. That's a terrible idea. No. And you're not, again, and I'm never mad at you guys, all right? I'm not angry. When I say it's wrong, I'm just saying from the background of my experience and my skills, my nutrition degree, my experience, right? You may want to reconsider doing that. I do not recommend juicing in general. If you want to do farmer's juice, That's different. But we got to be careful, because if you're juicing a bunch of carrots and apples and beets and that kind of stuff, watch what happens to your blood sugar. Yes, fat SB, right? Women, exactly. So women have the predominance of autoimmunity. Why is that? Love a shame. Think about like farmer's juice is basically just vegetables that don't spike your blood sugar. Okay? That's kind of more or less the definition of that. Stress is involved for sure. Hormones is 100% right. Yes. Hormone fluctuations is yes, absolutely right. So the fluctuations and the spiking of estrogen versus progesterone is a big part. But in general, right, women should be already estrogen dominant. Think about it. Women should be estrogen dominant. Okay? What provokes the increase of estrogen? There are two things that I'm thinking about that chronically drive excess production of estrogen. Soy has genistein, diadzine, so yes, there's some estrogen mimicking chemicals in there. Okay, sugar, 100%. So again, one of those issues, right? One of those issues is going to be blood sugar spikes. Because what happens is insulin, okay, increases the upregulation of fat cells, which increases estrogen. And not only that, but the ability for the pituitary to control estrogen surges is very relevant. So then what happens? Your ratio E to T and E to P, progesterone, that changes. So what did you just do? You just triggered your immune system. You just actually caused immune suppression, specifically cells called T regulatory cells. Bunny, fragrance, that's number 2, right? So parfum, phthalates, parabens, dioxins, BPA, volatile organic chemicals. Okay? So here, right, persistent organic pollutants, guess what? Same thing. Triggers that whole cycle as well. So persistent organic pollutants are shown to upregulate insulin, upregulate fat cells, trigger estrogen receptors, and it's going to be the same thing played out. On top of that, though, of course, you're also going to impair detoxification. So now you can't clear toxins from your body. And that is going to be an inflammatory root cause. That is going to drive your immune system crazy and bananas, and it's going to get pissed off. And if your immune system is pissed off long enough, remember, it takes about 7 to 9 years. That's after symptoms start for an autoimmune diagnosis to be confirmed. And we just had one of the largest triggers for autoimmunity that just happened in the past 3 years. And you were going to see, so we're 2020, right? Moms Lambie, I will pray for you. Pray for me too, please. I appreciate that. Sincerely. I love it. I mean, I can't tell you how much that means to me. Monica, yeah, so Monica's saying vaccines, but again, what correctly to me, right, is spike protein. So spike protein in either form, infection or vaccination, was inducing inflammation. Now, people that tended to have dysbiosis, insulin resistance, low levels of vitamin D, glutathione, right? Right? Glutathione is your shield. That is the barrier. That's what protects your tissues. So if you don't have enough glutathione, you're going to be more inflamed. So if you went into COVID with an inflamed body, guess what? Infectious trigger, spike protein was very, very good at upregulating inflammation. Spike protein went up, ACE receptors went down, angiotensin 2 went up, fibrinogen, clotting, that whole cascade. But also actually people started elevating their C-reactive protein too as a result of that infection. The inflammation, right, begets inflammation. And when you become chronically inflamed, you suppress your immune system. When you suppress your immune system, you lose control of your immune system. And then at that point, it gets confused and it starts self-targeting your own tissue. So to get out of that cycle, you got to get your glutathione up, right? We need selenium. We need N-acetylcysteine. We need amino acids. You may or may not be absorbing those amino acids, but you need those amino acids, right? If we didn't have enough vitamin D, there it is. There's another root cause. Vitamin D, right, just so you guys know, it downregulates NF-kappa beta, nuclear factor kappa beta. That's what drugs target. All these drugs that are coming out in the market, that's one of their hugest targets right there. Guess what? You can go outside in the sun and get that for free. So all these things are super, super important. Tada is saying, hey, Brazil nuts? Yeah, you'll get selenium from Brazil nuts, but the problem is that our topsoil has been eroded substantially in the past 50 years. So I use supplementation. So I use a supplement called Min Power, M-I-N Power. It has zinc, selenium, magnesium, potassium, calcium. It's a multi-mineral, and that covers essentially all those minerals. Claire, you better believe it. It'll ship to the UK as well. AROB, the cysteine I mentioned was called N-acetylcysteine, NAC or NAC. Landon, your body produces vitamin D from the sunlight because basically you hit receptors on your skin, and then what happens is it actually starts to form a pro-hormone. It goes through your kidneys, and those kidneys then actually activate your 25-hydroxy vitamin D3 from an inactive form. Well, it's less active. It's called vitamin D2, 125. And then through actually your kidney function, you actually produce active vitamin D. So again, if you have the adequate exposure, if you spend enough time in the sun, we're not trying to get sunburnt, right? But we're trying to get enough sun, and you're not pasting yourself with chemicals, right? Go back to here, right? Fragrance, chemicals, parfums, phthalates, parabens. So if we're not covering ourselves up all the time and putting chemicals that block UVB, then we can actually synthesize vitamin D. And you can actually get up to 10,000 IUs in one session. Okay? Just Jesse, if you go to our bio in our link tree, you'll find it in our store. Okay? Yeah, Min Power. Good. No, Landon, that's how I work too. I need to know how things work before I kind of believe it, and I can so I need to read about it. I need to kind of chew on it, and I need to make sure that makes sense, and then that's when kind of I'll go and I'll make changes. So what about this leaky gut thing? There are seven mechanisms behind leaky gut, and yes, inflammation is causing leaky gut, but leaky gut, right? Leaky gut leads to more inflammation. Leslie, great idea. Stop using hand sanitizer. In fact, again, we are way too sanitized. So there is a hypothesis out there called hygiene hypothesis. As our society becomes cleaner, more sterile, look what's happening in hospitals, okay? We get more problems. It is a good thing to have your kids exposed to cats and dogs and hamsters and lizards and horses and cows and sheep and pigs and all of it. What's happening in hospitals, it's getting harder and harder to treat infections because they're creating a sterile environment, which is basically causing a arms race. Because of our overuse of antibiotics, because of our overuse of antimicrobials, we have now selected super strains. And that leads to nosocomial infections in hospitals. Right? So we lose the good stuff, and then we create susceptibility for antibiotic-resistant infections. Look at what happens with people who get C. diff. Clostridia difficile, toxin A, toxin B, those are immune. Guys, that is, I probably see at least a handful of C. diff cases that have then caused autoimmunity. Because guess what? Anybody here had antibiotics and they were never the same? Yeah, after I had that fluoroquinone, after I had that Cipro, after I had that Z-Pak, man, I was never the same. Yeah. Because you eradicated, again, your microbiome, your flora in your gut is necessary to tamp, right? It is going to regulate inflammatory causing bacteria. Yeah, Cipro, yikes. I'm not surprised that there's a class action lawsuit going on with Cipro. I mean, you look at all these people that have had torn tendons, Achilles avulsions, 6 months, a year, 2 years later after having ciprofloxacin, ciprofloxacins, fluoroquinones. It's rough. And that's exactly also what happened to me. Prior to going into grad school, I was taking antibiotics every time I got a cold because my dad's a veterinarian. So he's like, hey, take some amoxicillin when you get a cold. And I'm like, Dad, are we treating a viral infection or bacterial? He's like, well, I'm just covering you for the bacterial infection. I'm like, dang it. Why did you do that? Bad idea. Queen E, you can absolutely heal from antibiotics. The crazy thing is, guys, is that when you take an antibiotic, there are actually 3 things that you should be on simultaneously. This is not Ashley Wolverton. You can talk to me one-on-one, okay? Absolutely, 100%. We do one-on-one care, okay? So Ashley, you just want to grab something called a discovery call, and that's in our bio, in our link tree, and then you can talk to staff. And that's a free call, okay? But if you want to do care for us, it's $350. It's a 90 marker blood panel, 90-minute consult with me, and then that's when I design care from there. Okay. So, anyways, what was I saying? The 3 things. Okay, so if you take an antibiotic, okay, there are 3 things that I recommend people take. Okay. 1 is you need to be on a prebiotic. Remember, prebiotics give us the ability to have something called short-chain fatty acids. Short-chain fatty acids like butyrate feed the good bugs. They also stabilize the population. So the prebiotic that I recommend is called Prebio Power. It's a modified guar gum. It's called Sunfiber. That's, again, it's in our bio. I know you guys are going to ask this right now. It's in my bio, in my link tree. If you go to Dr. Quality Supplements and hit that button, you'll see it'll pop up. Okay, even for kids. And the great thing about Sunfiber is it doesn't cause gas and bloating. Unless you're like, I want 2 scoops. And if you take 2 scoops the first time you ever take this product, you're probably gonna get some gas and bloating. But the great thing is it's no grit, there's no taste to it, it dissolves in water. It doesn't mess you up. It doesn't cause a bunch of gas and bloating. If you've ever taken inulin, you know that stuff is like, woo, get ready. Because you're gonna start firing off shots from the back end. Okay? So 1, prebiotic. 2, I actually recommend people take a probiotic that's called Saccharomyces boulardii. Okay? Saccharomyces boulardii is actually a yeast. And so the reason why you want to take that is because it bumps your mucosal immune system up, but it competes against the bad guys. So if you do take an antibiotic, right, or you're just trying to bump your immune system, because here's the thing, many times when I get stool tests back from clients and we're custom designing what they need for supplementation, I will use Saccharomyces boulardii as well, because it will actually push out the bad guys. That's a product called Git Power, G-I-T Power. Okay? The last product that I recommend for people is called ImmunoPower, Because again, if you upregulate inflammation while you're taking an antibiotic, guess what? You're suppressing your immune system. So you become more susceptible to secondary post-antibiotic infectious issues. So Immunopower has 3 probiotics. It's got alpha-lipoic acid, green tea, vitamin A, D, and K. I designed that for autoimmunity specifically. All of those things upregulate something called interleukin 10. IL-10, that's a chemical messenger. When interleukin 10 goes up, you stimulate regulatory cells, and that will drop inflammation as well. Nure Kara, yes, inflammation. So C-reactive protein is a form of inflammation. Not everyone has an elevated C-reactive protein. But if you guys are dealing with brain fog, joint pain, the vitamin A form of that supplement is preformed retinoic acid. So it's activated vitamin A, okay? So what is it? Retinol palmitate is what it's called. You guys, just again, this is a quick sidebar. What about carrots? Carrots are a good source of vitamin A, right? Anybody agree with that? Stella, I'll come back to that in a second. No. Carrots are not a good source of vitamin A. Carrots are a source of beta carotene. 56% of Caucasian women cannot convert beta carotene into retinoic acid. So what does that mean? No, it's not a bad thing to eat carrots, by the way, guys. Carrots are great. Carrots are good for you, okay? But if you're trying to get your vitamin A from carrots, it's not going to happen. It doesn't do well, especially in women. You have genetic issues, which is in present of 56% of the Caucasian population. Okay, I don't know what the stats are on Latinos and minorities and African Americans, but I can tell you, at least from what I've read, 56% of Caucasian women cannot convert beta carotene. So you need to have that already pre-formed. So what would that be? That's your liver. Murray. That's right. Vegans, listen up. Okay? I love vegans. Okay? I love animals. They're delicious as well. Cod liver oil, liver, taking a supplement as well. That's the way to do it. But just make sure you're taking the right kind. Because if you're taking a beta carotene supplement, you're not getting vitamin A. You're probably not going to get, you're not getting retinoic acid. Trinkets and Chi-Chis, there's something about research, it's biased. So they're going to look at different populations at different levels. So yes, I know more white women stats because more research is done on white women than it is done on African American women. However, there's a lot of research out there about African American women as well. It's not just that I'm racist, okay? Don't go there, okay? What gets rid of E. coli? Cranberry, actually. So, Ash is saying that she cured her autoimmune disease with raw eggs, which sounds a little ridiculous, calling you out, okay? Because you can't cure autoimmune disease. You can put it in remission. Maybe you put your autoimmune disease in remission, and if you did, woo, fantastic. Love that. But again, and raw eggs are actually a pretty good source of protein, great fat, great nutrients. However, there's sometimes issues if you don't cook stuff, okay? EMK, the best supplement for joint pain and inflammation is your body. It's what your body produces. So when we go back and look at what are these inflammation root causes? Remember, again, microbiome is huge. Occult infections are big deals, right? Leaky gut is a big deal. I had said this, 7 different mechanisms of leaky gut. You guys want to hear that? You guys want to hear what are the 7 different common mechanisms behind leaky gut? Because you can't have autoimmunity without leaky gut. Okay, so let me list those out. Diet, medication, so diet, processed, refined, right? Crap. Diet is going to drive leaky gut. Gluten, dairy, A lot of people out there in this live right now, you're still eating gluten, you're still eating dairy, and you're wondering why you have brain fog and fatigue and joint pain. That's a big reason right there. Yes, dairy. I know. It sucks. Okay? So now some people tolerate dairy. Some people tolerate wheat. But most American wheat is sprayed with pesticides. So bad news bears. If I go to Europe, if I travel to Europe, I don't react to the wheat over there. You can't cure autoimmunity because there's genetics behind it. Again, autoimmunity is genetic predisposition, environmental factors, triggers, and leaky gut. So we're talking about the 7 things that drives leaky gut. Uniquely, I love bread too. Believe me, I would be drinking a Guinness right now and eating like a slice of sourdough artisan bread if I could. It's not going to work out. Okay? Tammy, cheese came straight from heaven. You know, you can make an argument for that, especially if you're in Wisconsin. But no, there's some people that lose. So what happens? Again, remember, part of the leaky gut process, guys, is that you destroy the barrier. Again, we're talking about the 7 mechanisms of leaky gut. If you destroy that barrier in your gut, right, what happens? You will lose tolerance to dietary proteins. That means that people develop food reactions the longer and the more severe they have leaky gut. You guys know what I'm talking about. I'm reacting to foods and I didn't react to them before. Oh, I'm reacting to chemicals. I'm reacting to detergents. Oh, I can't handle perfumes. Oh, why can't I eat pizza anymore? You are losing oral tolerance because you have leaky gut. Now, again, guys, you can remove those foods and you can still have symptoms. And that's probably true for a lot of people on this live. You've removed gluten, you removed dairy, and you're still struggling because there's still leaky gut going on. You may have occult infections. You do have low levels of glutathione. You haven't balanced your vitamin D. You haven't detoxified from chemicals. Do you see what I'm saying? There's just still issues. Don't give up. Please, don't give up on yourself. There is so much hope. You guys have no idea how much hope there is. God gave us the ability to heal. Part of the issue is that we have to get out of our own way. You need to give up and lend some authority to people who are designed to help find your root causes. I know it's hard to trust healthcare practitioners because many people here on this live have been beat up by Western medicine. They've probably been beat up by Eastern medicine and alternative medicine. It's painful, it sucks, and a lot of times you just want to give up. But I know there's a little voice inside for many of you, and you're saying, but maybe if I did it right this time. Maybe I'm not seeing the things that I can't see. And that's why I love functional medicine, because good functional medicine practitioners in the first visit should point out the obvious that is not obvious to you. Sorrento, how do you know if you have leaky gut? Joint pain, fatigue, brain fog, symptoms going up and down, up and down, up and down. Food sensitivities, chemical reactions, sensitivities, right? Losing tolerance over time. Chronic infections. You take 20 supplements and you're like, I don't know. I think I got it. I got my 20 supplements. And I'm like, again, treat the right thing. Alicia, you can get a diagnosis for leaky gut 2 different ways. You can do a lactulose test where you consume sugar, and then if you pee it out and you pee a lot of sugar out, you've got permeability, you've got leakiness, okay? I use a blood test, and I use that as part of a test that's called the Wheat Zoomer from the company that we use, and it'll actually check antibodies against the structures that make up your gut lining. So then you know if you're making antibodies against the structures in your gut, guess what? That lining is breaking down and you're letting things through that barrier. So there are 7 main mechanisms that drive leaky gut. If you guys want a handout on this, it is in my bio in my link tree. I'm sorry I didn't mention that before. I apologize. But I just came out with a 3-page PDF on healing leaky gut. Okay? We're 100% online, by the way, guys. Okay? But you guys can go into my link tree in my bio. I had so many, I talk about leaky gut almost every single time I have a lecture. So I'm like, okay, like I got to give people more. I got to give you guys more. Like I need an actual handout. So it's nice. It's a PDF. It talks about supplements you can take and diet changes you can do and, like stuff. Hopefully get you guys more on track as far as what you could be doing. Okay? So I said diet is a huge trigger for leaky gut. Secondly, medications. Sunshine, thank you. Appreciate the gratitude so much. You guys have no idea. You guys have no idea. Those people that are in healthcare know. What healthcare practitioners just went through COVID is insane. Absolutely insane. Quinn, yes, fibromyalgia will equal leaky gut, but also remember there's always reasons that drives leaky gut. You guys, I'm never going to tell you just take my leaky gut supplements. That's a marketing thing, okay? Yes, I have the leaky gut trio. I start my clients out that I suspect to have leaky gut on the leaky gut trio. There's 3 products in that. However, if you have fibromyalgia, there's a very high chance that you also have small intestinal bacterial overgrowth, or SIBO. And you're just not able to make enough serotonin because guess what? You've got overgrowth in your gut, and you got to fix that. Now, when you remove the infection, because again, yes, infections are a chronic cause of leaky gut, then you have a chance of rehabbing your gut and getting yourself back on track. So again, diet, medications, proton pump inhibitors, Nexium, omeprazole, pantoprazole, all those things, they're all garbage and they will cause long-term issues. That's my opinion. Okay? Antibiotics, steroids. Those 3 right there, those are the worst. Alicia, your kiddo's taking lactulose. They're probably taking lactulose because of constipation. Alicia, let's find out why that kid has constipation. Okay? Because no, I wouldn't. Lactulose has some prebiotic benefits to it. Absolutely. And I like it for that, but I don't use lactulose long term. So if you want help with your kiddo, we work with kids too. The adults are the harder part usually. We got to train the adults before the adults can train the kids. Yeah, if you've been taking antibiotics and steroids and proton pump inhibitors, my goodness, please call us. Please reach out to us. We can help you. Okay? Diet, medications, infections cause leaky gut, mitigate leaky gut, drive inflammation. You got to find them. You got to remove them. You got to improve that microbiome. 4, stress. Stress is a killer. Stress will drive inflammation. Stress suppresses your beneficial flora, which is why when you're done with the stress, many times people get sick. Right? Plowed through midterms, plowed through finals, and then at the end of the finals, boom, got sick. We moved across the country, and then man, everybody got a cold. Yeah, you were immunosuppressed as a result of that chronic infection, that chronic stress. Nicole, go to the bio in the link tree. You can grab an appointment there. Yeah, Kimberly, yes, probiotics are going to help. They're going to be beneficial, but you got to know what you need. You have to know what you're doing with probiotics. Probiotics are very strain specific. Prebiotics are not. You benefit everybody with prebiotics. You need to know what and how much prebiotic to use, just like you would need to know what and how much probiotic you should take as well. Time to heal, love fermented foods. 100% endorse that right there. Carrie 345, the leaky gut trio is Immunopower. It's a probiotic nutrient combo. Okay. Prebiopower, that is a modified guar gum it's a prebiotic, and gut power. And that is hydrochloric acid and zinc carnosine. Zinc carnosine has been shown to actually heal the barrier. So I use hydrochloric acid because most of my clients have deficiencies of HCl. Okay, so we said diet, medications, infections, stress, hormonal, lack of thyroid hormones, lack of estrogen, lack of progesterone, lack of testosterone. Why do you think women tank when they go into postmenopause? Man, I was doing okay, and then I went and I hit menopause, and you lost your hormones and you're not regulating your immune system, you probably turn on the leaky gut process. Those are the women that we help. I love helping women because they appreciate me. And that's what we want mainly as healthcare practitioners. We want to be appreciated. We just want to know that we're helping. That's all. I mean, like, yeah, we want to get paid, but we want to know that we're helping people and changing their life. That's why I've been doing this for 15 years. Without the gratitude, F it. Like, I'm done. The money ain't worth it. Kathy, thank you. Appreciate you too. Okay? So, diet, medications, infections, stress, hormones, neurologic, brain trauma, concussions, chronic repetitive mini concussions. You've had strokes, TIAs. You've had adverse childhood experiences, and that has dampened your vagus nerve. What is your vagus nerve? It causes stimulation to your gut. You produce digestive enzymes from your vagus nerve. Right? Kath, there is so much hope. So much hope. There is so much vitamin H. But it's helpful if you're led. It really makes a big difference if you're led, right? It's hard to do this on your own, guys. When I had my own chronic issues, I needed someone to help me. I went through 8 practitioners, and the 9th provider was a functional medicine provider. He changed my life. And that's when I thanked God, and I told God that's what I was going to do. And I did. And I've been doing it for 15 years. So brain and emotional trauma will change your vagus nerve. That's important. Lastly is metabolic. For those people that aren't aware, we already talked about this, but spiking blood sugar, when your blood sugar is out of check, it's going to cause problems. Do you guys know that sweet potatoes will spike your blood sugar, especially if you fry them? Foods, when you cook them, actually have a different glycemic index. How would you know that? You would monitor it, because if you're crashing after meals, if you're fatiguing after meals, if you're craving sugar after meals, you're insulin resistant. If you're showing elevated triglycerides, you're insulin resistant. If you have high blood pressure, more than likely you're insulin resistant. If you're overweight, very good chance you're insulin resistant. If you're waking up at night at the same time every night, you are probably insulin resistant. If you have a diagnosis of polycystic ovarian syndrome, if you have abnormal cycles, if you have hair thinning, facial hair, acne, you are probably insulin resistant. Insulin resistance drives leaky gut. And if you're shaky and irritable and lightheaded in between meals, or if you're going too long between meals, you're dysglycemic. Now you're spiking and you're dipping, and you need hormones, adrenaline typically, which guess what? Ladies, I have generalized anxiety disorder. I call BS. I would say you probably have a blood sugar issue. And every time you drop, guess what? Your anxiety, it spikes. Gadir Ode, different ways to heal, okay? I like that name. It's super cool. We're doing a DIY program next month, guys. So if you guys don't want to come and work with me one-on-one, that's going to be my route for you guys. We're going to have 50 spaces. We can only handle 50 people for my DIY program next month. So more on that is coming. If you guys want more information on that, grab the Leaky Gut handout, because then you'll actually get the Leaky Gut handout, and you're going to be on my email list, and we'll send you information about that DIY reset program. Secondly, if you guys want to grab a discovery call, talk to my staff. If you guys want a one-on-one consultant, if you guys want to be led, i.e. if you want to get specific individualization as far as recommendations, that's what I've been doing for the past 15 years. Social media is just a great place for me to talk about this stuff and connect with like-minded people. But at the very... Right on, Becky. Woohoo! Rajesh, if you're from Malaysia, you need to email info@drautoimmune.com. So international people, email info@drautoimmune.com. Our discovery calls are really set up for domestic clients. Okay? But we work all over the world as well. We got people in United Arab Emirates. We got people in South Korea, Great Britain, Canada. Where else? Amsterdam. More. Spain. We've worked all over the place. So it's a little bit harder international, but we can usually make it work. If you're motivated, that's the whole point of this. You got to be motivated. Otherwise, you're not going to change because, again, most of the inflammation is coming from your lifestyle, the things that have happened to you. So you need to then start making different choices. Different choices, positive choices are going to lead to a better outcome tomorrow. We start making changes today and we sacrifice today for a better tomorrow. That's how this works. It's called delayed gratification. Very hard if you have attention deficit. Believe me, I know. But it is worth it if you are led. So, guys, that being said, making sacrifices, I gotta go pick up my kids. Okay? So I'm gonna go have some fun with my kids. And if you guys need anything, you're welcome to DM me. Like I said, we have that handout on leaky gut. Punch in your email. We'll send that out to you. If you guys need more beyond that, again, you can always DM me as well. Again, the big takeaways from this lecture, okay? And by the way, if you guys want this lecture, just email info@drautoimmune.com. I'll go ahead and put it up on YouTube. Why not, right? Let's throw it up on YouTube, on my channel, and then you guys can actually watch the whole lecture. But again, the big takeaways were, one, anti-inflammation drugs are short-sighted and limited as far as what they're going to do. It'll eventually end up kind of robbing Peter to pay Paul. So taking a root cause mindset of what causes inflammation, i.e. your microbiomes, not just your microbiome in their gut, but microbiomes, is a big deal. Tending the garden is a big deal. Fiber, lean quality proteins, essential fatty acids, sun, sleep, vitamin D, right? Eating for your health. Being present at the very beginning of your day may be one of the most important aspects for your inflammation. Why do I say that? Because if you're not present, you're not going to make conscious choices. So what does that look like? Well, I went and I got Wendy's. That is not a conscious choice because you just chose inflammation. I was never outside. I never got any movement and I sat in my chair all day. That was a conscious choice. Unfortunately, that promoted inflammation because your body needs to move on a regular basis. So there's so many different ways you guys can slice this, but just understand, pick one thing, right? Work on that, get that under your belt. Remember, it takes a couple months so you get new habits, new lifestyle in place, and then go to the next thing. Okay? Or come back and listen more, and this stuff will start to slowly integrate by osmosis into your brain. And hopefully, again, through that vitamin H, hope, you guys will start to see that you do not have to live the pill for the ill lifestyle. You can have robust, abundant, amazing health and not have to think about that and focus on that at all times because you've invested in the right things that are promoting optimal health. Okay? So again, God bless everybody here. You guys are awesome. Thank you for hanging out with me. And again, tomorrow, 6:30 Mountain Standard Time, I will be on my next live. And we're going to get after it again. So you guys bring your positive attitudes, bring your questions, and we're going to have fun, and we're going to learn more. Again, this is Dr. Ian here, Dr. Autoimmune. Let your health soar.